Let's discuss frontotemporal dementia. It is neurocognitive disorder that presents with early onset, usually age 50s or 60s. And there are two major proteins you need to remember, and the first one is hyperphosphorylated tau protein, also known as Pick's body, and the second one is TDP43. Now this abnormal inclusion of these two proteins is what leads to frontotemporal dementia. Related neuronal death in frontal or the temporal lobe causes stereotypic behavioral and personality changes, and that those could be, the first one is disinhibition, like for example patient may start flirting and may urinate in public because he does not have any inhibitions. The second one is apathy. For example, patient don't care about anything now. And there is empathy loss. The patient starts showing less affectionate towards their partners. The fourth one is ritualistic actions. That means he will do a repetitive, he or she will do the repetitive actions again and again. And the fifth one is hyperorality. For example, in the past patient might not like chocolates and now he starts eating an entire box of chocolates. And the last one is executive dysfunction. For example, getting lost while driving home from the work. In addition to these findings, about 20% of patients develop motor neuron disease with upper motor neuron, for example hyperliphrexia, and the lower motor neuron sign like fasciculations, and this could be similar to those in ALS or the amyotrophic lateral sclerosis, but it is very well possible to be coinciding the signs with frontotemporal dementia. Diagnosis is usually clinical. Neuroimaging is often performed to exclude other etiologies, for example, masses or the stroke, and it is in the imaging we confirm this by the frontal or the temporal lobe atrophy. Frontotemporal dementia is rapidly progressive disease and with an average survival length of 8 to 10 years after onset. Treatment is palliative using behavioral management, for example, exercise, trigger avoidance, distraction, and the redirection. And symptomatic tailored pharmacotherapy with selective serotonin reuptake inhibitors or atypical antipsychotics may be needed. Thank you.